surgical masks and N95 respirators for our healthcare workers and our first responders. And if you have them to donate, please remember to email out for donations to COVID-19, COVID-19 donations at AlleghenyCounty.us. Wear a mask when shopping at essential businesses, when visiting your healthcare provider, on public transportation, and interacting with customers and clients at essential businesses. I have my own mask that we made at home. My wife Kathy helped me make, and we are able to slip it on. And that's the kind of mask that we're asking people to wear when they go to these places. If you need to know how to do that, both the county webpage and the state's webpage contain information on how you can make a homemade mask. There are also numerous tutorials if you Google masks, and are available online. I also recognize that not everyone has the resources right now, and I'm grateful to our Department of Human Services and all of our partners who are continuing to work to ensure that everyone in our community gets the essentials that they need. If you are in need of help, please contact our partners at the United Way, 211, dial 211, or visit resources available on the county's website at www.AlleghenyCounty.us/coronavirus. It includes a free food site map. Since our last briefing that we held, we received the news that there are additional cases of COVID-19 in both staff and residents at our Kane Community Living Centers and cases at the Allegheny County Jail. As we said a week ago, with community spread, we expected that COVID-19 would soon impact not only county facilities and departments, but the entire region, and we've seen exactly that. We're in the middle of a crisis here and focused on doing everything we can to make sure that our residents and staff are safe. I couldn't be more proud of the work that our employees are doing each and every day, tirelessly on behalf of all the residents of this county. These dedicated employees are working tirelessly and committed to serving the public in all that they do. COVID-19 and its impact is constantly evolving, and the county has all hands on deck so that we can be responsive to adapt quickly to all developments and information. To those employees that care that you are providing to our residents at Kane and the inmates at the jail, it's integral to our response and the service that we provide. I want to thank every one of those employees who continue to work and give new meaning to the word public servant. And I also want to continue to emphasize the physical distancing that we're asking residents to continue to do in our parks. We're not closing our parks. We want to make sure that people are able to get out and recreate, but keep that physical distance and be able to not do contact sports. And that's why in our parks we have signs up advising people how they can do things. Again, we have been at this a number of weeks. We got on this early, and I can tell you so far the numbers have been very, very positive. When you look at some of the other places around the state and around the country, Allegheny County in Western Pennsylvania has really done yeoman's job with all of us cooperating and coming together. I want to also thank our healthcare providers, our institutions, the University of Pittsburgh, UPMC, AHN, Heritage, St. Clair, and the Health Department, and Dr. Bogan and her team. The cooperation we have seen throughout this county and throughout this region right now really makes you proud of the work and what we can do. So we want to continue to work together by staying apart and keep flattening that curve so we can all get back to where we want to be in the normal lives, whatever normal is going to be when we come out of this after doing this. So at this point, let me turn it over to Dr. Deborah Bogan, who's been leading a lot of this with her team at the Health Department, doing a fantastic job in keeping us safe. Dr. Bogan?
Thank you very much, County Executive Fitzgerald. So first I'd like to talk to you about the county's recent numbers of cases, hospitalizations, and deaths. As of today, we have reported 721 confirmed cases, 113 hospitalizations, and 10 deaths. As Mr. Fitzgerald said, we are cautiously optimistic about the slow rise of cases in our county. About 10% of these tests have come back positive. However, we know that this number doesn't represent all the cases in the county, but only those that are tested and test positive. There are people who are showing symptoms of COVID-19 who are not being tested. There are some people with symptoms whose tests are negative, and we have people who have the virus and are not showing any symptoms. However, it appears that the physical distancing, isolation, and quarantine measures, as well as the mitigation measures implemented by the governor, we all asked you to do, is having an impact. And all of these together seem to have contributed to our relatively low number of cases, hospitalizations, and deaths. I want to really thank the county health department's team of case investigators and contact tracers, including a team of medical students from the University of Pittsburgh who joined us recently to help out. This team has worked on following up on each case and their contacts who may have been exposed, and we believe this has been really important, key to slowing the spread. Other regions gave up on contact tracing, but the county health department team has really stayed committed, and that has been really important. We must keep up these efforts and stay vigilant to give us the best opportunity to continue this trend, to beat the pandemic and begin to think about reopening our county. Even though we're doing okay, we're preparing for a surge. We want to emphasize that it's too soon to let up. We are aware of confirmed cases at nursing homes and long-term care centers across our county, including within our cane centers, and of the recently confirmed case among inmates at the jail. We are watching these cases closely and doing what we can to control the spread of the virus in these facilities. We share with these facilities the latest guidance from the CDC, the state health department, and our staff on how to stay safe and protect all those in these facilities. We have supplied additional personal protective equipment were delivered to the cane facilities and the jail over the weekend and again this morning. You've likely heard in the news the last few days about COVID-19 and race. I just want to be clear to everyone that this matters to us too, and it's really important. Looking at COVID data by race is important because we know that communities of color already have poorer health outcomes in Allegheny County, and we need to know if COVID-19 is affecting those communities to a greater degree. Part of the challenge is that until you get enough data, you can't draw any conclusions. Dr. Levine said on Tuesday that statewide data on race is dependent on what information is available, and we have the same challenge here in Allegheny County. Neither our health systems nor our laboratories routinely provide data on race in our reporting system. As a matter of fact, less than half of our reported COVID cases in Allegheny County contain data on race, and we will not publish information that's incomplete and could be misleading. However, our epidemiology staff is working on a strategy to incorporate demographic information about our county into our reports. In an effort to provide you more information about COVID-19 in Allegheny County, we are launching today a dashboard that provides more granular data. The dashboard is on the county's website and is accessible through the COVID-19 information page. It shows the following data. It shows case counts and rates by municipalities and neighborhoods in the city of Pittsburgh, the number of people hospitalized, and a percentage of patients in the ICU or on ventilators. I want to caution you that we know that the data on hospitalizations is likely an underreporting because these data are based on our case investigation call. So if someone is hospitalized or released after that date, we don't know, but we are working to improve the reporting on these numbers. We will continue to push out information through the Allegheny Alerts website, Facebook, and Twitter. And finally, I want to echo a reminder from the Pennsylvania's First Lady, Frances Wolf. Many of you can help. Volunteering is essential and allowed under the statewide stay-at-home order. On Tuesday, Frances Wolf encouraged people who can to continue to volunteer. We ask that people maintain physical distancing while volunteering, and this may mean ringing a doorbell with a food delivery and then stepping away from the door, volunteering on your own, looking for volunteer groups that are small, in small groups. We want people who volunteer to stay safe. Another way to help us know how you and your family are doing is to participate in a University of Pittsburgh and in partnership with lots of organizations around our county who are distributing a family strengths survey to learn how families are doing, what resources they're using, and what they need right now. The survey is available online at www.pediatrics.pitt.edu/family-strengths-survey. It's anonymous and it takes about 6 minutes to complete. And with that, we'll take questions. Thank you.
Can you repeat the website, please, for the sign language interpreter?
Sure. The website is www.pediatrics.pitt.edu/family-strengths www.health.gov/survey.
The first question is from KDKA Television. Are we beginning to bend the curve in Allegheny County? Have the number of cases begun to plateau or decline?
I would say we're cautiously optimistic that we're starting to see a trend in that direction. I don't know that we have enough data yet or enough days of testing and enough testing to say we're there, but I think we're cautiously optimistic that we're seeing some positive results. The fact that today we went up 31 cases, that's not many more than we've gone up even a week or two ago. So we don't see this big spike in number of cases that are going up. So what I'm taking from that is the social distancing that everybody's been doing and the stay-at-home orders that the governor and the health department have indicated are starting to work. But the last thing I think we want to do is take the foot off of that gas at this point. We want to continue that, and hopefully those numbers will continue in that direction. Dr. Bowe?
I agree completely with what your response was.
The next question is from the Post-Gazette. What preparations are being made for a further release of prisoners from Allegheny County Jail to prevent the spread of COVID-19?
That's been an initiative that has really begun starting around March 18th. And I really want to thank Judge Clark and the courts, President Judge Kim Clark, our public defender, Matt Dugan, and his team in the district attorney's office. They really began going through, I think it's called motions court, if I have that term right. And thus far, roughly 900 inmates have been released since that time. So they're going through on a case-by-case basis to try to move out low risk and low inmates, low charges, nonviolent charges. So that they are going through that, and the work that team has been doing has really had a great impact. So I think they're continuing. In fact, I know they're continuing that effort every day, and will continue along those lines.
The next question is from WESA. Does the County Health Department have a role to play in countering the outbreak at St. Barnabas Nursing Home in Gibsonia? And if so, what measures are being taken?
So the health department, this is an issue across our region, across the country. People who live in communal living facilities are certainly more at risk for spread of the infection in those facilities. We don't, at the County Health Department, oversee those facilities, but we do provide the latest information to those facilities on how to prevent spread of the infection. So that is really our role. It's not to oversee those facilities.
The next question is also from WESA. In the last month and a half, has a medical examiner seen an uptick in medically unattended deaths?
That would probably be a question we'd have to refer to the medical examiner. I have not heard Dr. Williams mention that, but that's something we could follow up on.
From WTAE, what do you want residents of care homes and employees of those homes to know about the county's response and efforts to keep them safe?
Again, what we've been doing is providing them the best information we can on how to quarantine and isolate patients, how to take care of their staff with proper use of protective equipment, and to provide them, the county emergency services is providing them with PPE as needed. So I think that's what's most important in our role in the County Health Department.
Yeah, and I think also to follow up on that the Health Department has really put out a lot of great information for lots of different facilities and a lot of different workplaces to follow, along with the Secretary of State and Dr. Levine at the State Health Department. And I think in collaboration with both organizations, the cooperation we've seen to get that information out there and make it very readily available so people at these facilities can see what actions they should take, distancing, proper protocol, those type of things, has been very, very helpful.
There are a number of outlets that are asking additional questions related to the case announced at the jail today, related to what types of actions are being taken and plans for future steps.
Well, the warden and the jail very early on made some changes, going back almost a month, limiting social and professional visits, and then a few weeks later, along with the courts, stopped restricted legal visits. Obviously, that was with court approval. Active screening when people go in, having their temperature taken, and then doing other tests along those lines, and asking questions regarding if people are sick at where they live, if they have any respiratory issues, type of contact tracing that Dr. Bogan talked about early on. So the warden is following all the guidelines of both the health department, the CDC, and the State Department of Health.
Public Source is asking how many in-person polling places will be provided for the June 2nd election, and how will the county avoid a situation in which there aren't enough polling places for the in-person demand and overcrowding could create a health risk? That
is something we are working on, because I think a lot of us saw what happened in Wisconsin yesterday and have some concerns. I've had some discussions with some of our state leaders to see we've got an election in little under 8 weeks. And obviously we're encouraging so many people to vote by mail, because you can certainly do that now, no excuse mail-in voting. We'd love to see more people do that, but we are working on those very plans, because that is a concern, and we'll be certainly working with Dr. Bogan and her team for the best recommendations we can do that. We obviously want to make sure that we protect our democracy, so to allow everybody who's eligible to vote and wants to vote can get out there and cast their ballot for the candidates that they want to support. But we obviously always want to make people, both the voters and the poll workers who work tirelessly. And again, these are folks who are great citizens and do this for all the right reasons, for those 13 hours that they sit there and process people to go vote. So we're working on a plan, and hopefully next week we'll be able to announce something.
This question is from KDK Television. How many hospital beds do we have in the southwestern Pennsylvania region? How many ICU beds? How many beds will be needed at peak surge, and how full are those hospital beds right now?
Chief Matt Brown keeps all of those data, and he reviews those every single day as part of our emergency services plan. And so I could refer you to him for those exact numbers. I can tell you that we have, certainly right now, plenty of availability of hospital beds, ICU beds, and ventilators in our region, and there is no concern about availability at this point. We are far from exceeding any needs at this point in our region.
Yeah, and at this point, I think that's what Dr. Bogan says exactly right, and that's really why we've tried to really do all the steps that everybody in the region has taken, and we've seen a lot of success along those lines. But that doesn't mean if we let up that weeks from now it could go the other way. So we're making plans, obviously, to have the preparation and the cooperation that we've seen with our healthcare facilities has been really great. We've been very thankful for that. So Chief Brown and his team are working through that, and as Dr. Bogan said, they're making the plans that hopefully we never have to see.
Agreed.
This question is from the Pittsburgh Business Times, but there are also two related questions from other outlets. I'm going to lump them all together here. Can you talk about the governor's order today for health systems, manufacturers, and others to inventory and potentially commandeer, their words, personal protective equipment and other supplies to other parts of the state as needed? Do you agree with that order, and how will it impact Allegheny County's response? And then the secondary questions will be, how does that impact what we've heard locally about the need for PPE at facilities like Canes and the jail, as well as our hospitals?
Well, those are a couple different questions wrapped together, and I think when we're talking about some of the things for acute care, ventilators and such, I think the governor wants to make sure that those resources are moved to where they're needed most. And thankfully for us in southwestern Pennsylvania, it hasn't been here at this point. So there's other parts of the state that have had much higher numbers, much more acute responses to the virus. So I think the governor is absolutely right to try to maneuver and move the needed equipment over there. When it comes to PPEs, that's a little more balanced because you need those in all facilities. Certainly we talk about like our nursing homes, like Dr. Bogan talked about, our facilities in which folks are enclosed, communal living centers, those type of things. So for folks who are first responders, our grocery store clerks and workers who are there, they still need the PPE every bit as much. So those are kind of two different areas I think that we're talking about. Would you?
I agree, yeah.
This question again from WTAE. Can the county executive please address the mood of the county? It seems like every household has good days and bad days, good moments and challenging moments. How do we keep our spirits up?
Well, that's a great question. And it happens in every household, including the Fitzgerald household. I think we have moments in which, we obviously feel good about what's happening. We also want to return to what we would view as our normal life, particularly as springtime comes out, the weather gets nicer, and people want to naturally be out after been inside for a lot of the winter. But I think we also realize that this is a struggle that we've got to persevere. We've said this before. This is a war. This is a war against the virus, not against a foreign enemy that we've traditionally seen. So I think people have rallied very, very well. I think they've encouraged their children and their seniors to stay disconnected, to stay disconnected physically, but to be connected socially. And I think how technology's allowed us to do that, which we wouldn't have been able to do a number of years ago. It's probably from minute to minute or day to day, our moods will change on where we see this going. But again, I think for the most part, Pittsburghers are pretty pragmatic people that follow the advice of the medical experts, and I think that's what we're doing in this case, and we're just going to have to continue along that way.
We've been asked if Dr. Bogan would like to answer that same question.
Well, I was going to comment that certainly the mood has been up and down in our home as well. The rainy weather, of course, makes our moods worse, and when the sun comes out, we all want to be outside. There are people who I'm sure are struggling at home, and I want to remind people that there are great resources in our community. We are very fortunate to have Resolve and other emergency hotlines. So if people are feeling really blue and not just having that sort of up and down mood, they should reach out. They can call Resolve Crisis Hotline. They can call their health professionals. But if you are sort of suffering with more significant mood disorders and during these times, please reach out.
This question is from the caucus. Can you expand on how and why contact tracing has kept downward pressure on the virus's spread in the county, and whether the effort might be replicable in counties without a health department?
I think I understand. The question is, why is it important to do case contact? So after we identify somebody who has a case, we ask them who they have been in contact with. And those recommendations are now to ask for the 48 hours before they felt sick and further on. So we're trying to recognize that you can have spread before you have symptoms. And by calling those people and giving them clear instructions, we think that encourages people to really follow the instructions, right? Because I think if people are tempted, it's nice outside, they want to go outside. But contact tracing allows us to say, here's what we know, here's the information that you should be living by, and here are the resources. And so the more we can continue to do that, it feels personal to that person, right? Like, I have been exposed, and we think that keeps people following the instructions probably a little more closely. So our epidemiologists here have been dogged about really staying on that. And I do believe that it's had an impact in our community. In terms of other communities and how they can do that, I'm going to have to leave that for other people because I'm sort of new at my job and don't know the lay of the land across the state very well. But certainly that's what we've been doing here, and I encourage others who can to do it as well.
And we are fortunate that we do have a health department. As the questioner mentioned, not all counties do. So the fact that we have these professionals who are here and giving us very, very sound advice on how to get through this, it's a benefit that we have here in Allegheny County, and I'm very thankful for that.
This question from WESA. Last month, the county said it was identifying potential quarantine sites. Where are these locations? And under what circumstances would someone be quarantined? Likewise, some municipalities have placed homeless people in unused hotel rooms, which allows this population to better self-isolate. Is Allegheny County considering this?
On the second part of that question, our Human Service Department, Mark Cherna and his team are working on that, on how to deal with the homeless population and how to help that group of folks who certainly have challenges. On the quarantine sites, I think they're working on that, but I don't know that they would be revealing where those specific sites would be, but I think it is something that would be under emergency services. Matt Brown and his team would be, again, going through that.
That's my understanding as well, that there is some availability currently through our DHS folks, and they are utilizing those facilities if they're needed.
This question from WTAE. Many nurses and doctors are worried about bringing the COVID-19 back home with them and inadvertently infecting their families. Can they and first responders be housed in hotels to keep them separate from families? Is that something they should consider?
I don't want to speak out of turn because I don't have the information at the tip of my hands, but I do understand that some facilities may be doing that, but I would refer them to the hospital facilities themselves to ask.
We have time for one last question from KK Radio, asking whether there is a reaction to the jail lawsuit.
No, we typically don't talk about lawsuits. The only thing that I will say is I think in some of the testimony and some of the written things, and this is a lawsuit across the entire Commonwealth among all counties. Allegheny County has actually been pointed out as being kind of an example of being proactive on something along these lines. So it's again, I let the lawyers handle that, but we've been very, very proactive in working with the courts, working with the district attorney's office, probation, et cetera, all the partners to try to minimize the amount of population in the jail and release as many inmates as we safely can back into the community.
Any closing statements?
Yeah, I want to thank. I just want to thank the folks out there who have been so patient and so responsive. Good information is being given. We want to really follow our medical experts. We're so fortunate here in Allegheny County in Western Pennsylvania that we have this culture and this ecosystem of medical professionals, scientists who are working feverishly behind the scenes to come up with treatments, to come up with cures, to come up with vaccines, testing, all these things. They're not out there in the public eye, but we have this, and it's happening across the country. But we're certainly lucky to have it here and to be able to lean on those kind of resources to give us the good kind of sound advice for workplaces, for recreating, for how our families can live, all those type of things. We just got to keep heading in the right direction. We got to keep moving as we have been, and we've seen some good success so far and some good numbers, and we just want to continue that. So I want to thank everybody. I certainly want to thank Dr. Bogan and her team. We're proud of the work that they're doing. They're working literally around the clock to try to keep people safe in this county and in this region, and we're going to continue to do that.
And with that, thank you everybody for joining us. For the members of the media